that's not that effective. The next thing is now the big thing, the injections, right? So I think the best way to go through it is maybe the different types, because there may be 4 or 5 big ones that we use in the UK, maybe worldwide, but and how they kind of work and any side effects. So yeah, I'll leave it up to you how you want to start.
Yeah, so I guess officially, the first time that the injectable therapies became a weight loss treatment as opposed to a type 2 diabetes treatment was when Saxenda was launched. So Saxenda, or liraglutide, previously was called Victoza and was a once daily injection that we used for type 2 diabetes management. A lot of people don't even remember that now, because it was, years ago, and we stopped using it when the weekly injections came out. So when Saxenda came along, it was designed to allow you to treat people with a once daily GLP-1. People won't remember this because it's been masked so much by the newer weekly stuff.
Yeah.
But you in the diabetes world, you only went up to, you started on 0.6 milligrams, then you went to 1.2, then you went up to 1.8, and that was after a lot of haggling with NICE for type 2 diabetes management. But when you do weight management, Saxenda, it goes up to 3 milligrams. But even with Saxenda, you got maybe 5, maybe 10%, and then there was side effects, and it was a daily injection. It was just cumbersome for people to do. And then in January 2000, Ozempic was launched for type 2 diabetes. And in 2000, when Ozempic came around, it revolutionized type 2 diabetes management from an injectable perspective, because it really made a really hard-hitting impact, right? It helped people lose weight, improved glycemic control. And then as time's gone by, Ozempic's cardiovascular benefit was proven in terms of reducing heart attacks, strokes, death, all of that kind of stuff. Then people cordoned on to the fact that Ozempic, as a weekly GLP-1, was actually really good at helping these people with type 2 diabetes lose weight at the same time. If you read the SMPC or the product literature, it lists weight loss as a side effect of Ozempic, not a benefit, right?
Yeah.
But obviously we know now that actually it's not really a side effect, but it's a desired effect when you're struggling with, living with overweight or obesity. So then Ozempic became the thing, and people started using it off-license or off-label for weight management in people who didn't have type 2 diabetes. And then as that data grew, obviously the manufacturers, Novo Nordisk, then realized that actually there's a whole different group of people that we can help by using this. And that's where Wegovy came into play. So semaglutide was tried, tested, and not just up to the 1 milligram dose that we use for type 2 diabetes using Ozempic, but all the way up to 1.7 and then 2.4 milligrams in the form of Wegovy. So now we officially have Wegovy, which is the exact same medication as Ozempic. The active ingredient is semaglutide. But in terms of treating diabetes, you use the Ozempic brand, and you use that up to a dose of 1 milligram. But the Wegovy is exact same medication, branded differently so that you separate the two indications out. So it's used for the weight loss, and you go up to much higher doses too.
Interesting, because a lot of people, Ozempic is by far the most popular, right? And I took a lot of digging to try and get this on, and I still wasn't sure. So you're saying is Wegovy is the same as Ozempic, but higher dose.
But higher dose.
For weight loss.
Absolutely. So exact same medication.
So why is Ozempic so much bigger then? Like, is that just a
I think it's just because, it was first to market. It was the name that everybody associated with weight loss right from the beginning. Yeah, it was about 4 years ahead of its time, because Wegovy came in 2024, right? Whereas actually what you had was, Ozempic from 2000 onwards in the public sector, right? And so people knew the name Ozempic. And actually, it really took off when I think it was probably Elon Musk who, when he went on X and said, I use this stuff to lose weight, it just went everywhere. And then you had Oprah, and then you had Boris Johnson, and you had Jeremy Clarkson. You had everyone you could think of trying this stuff out. And actually, that's where it became a huge celebrity thing. Social media was rife with it. And whilst I, as a physician, I try and do this very much from a health perspective, we can't take away from the fact that social media and all the hype that's gone with this stuff has put it out there for people to be aware of, that you have got options. That's not necessarily a bad thing, right? At the end of the day, as long as things are done right and supervised, and you get the health care that you need and the assistance that you need to do it safely, I think, these things are there to help the millions of people who struggle day in and day out with their weight. So that was kind of where the Ozempic thing came from. Because it was around longer, and then Wegovy took over. And then obviously after Wegovy, now we have the next best thing, which is Mounjaro. So Mounjaro is the latest kid on the block. And Mounjaro is also a weekly injection. Its active ingredients called tirzepatide. What's unique about it is it's the first in its class of a dual receptor agonist. So everything before Mounjaro was a GLP-1 receptor agonist, okay? And GLP-1 is just one of those hormones that we talked about earlier. We talked about earlier.
Levels,
It reaches levels, right? The satiety stuff. But GIP is the second one. And what's interesting about the tirzepatide molecule is that they modified it in a way that it triggers or stimulates both GLP and GIP simultaneously. And that dual action just makes it more potent than even the Wegovy. So you see a greater degree of weight loss as a result of the combination of those two receptors being targeted.
Interesting. So, I mean, this is probably a very naive way of looking at it, but it sounds like the pecking order almost is number 3 would be Saxenda, then actually, maybe it'd probably be Saxenda, Ozempic, Mounjaro, Wegovy.
No. So if you were going to look at efficacy of weight loss, as it stands at this point in time, it's Mounjaro's top of the rung, Wegovy's second. We don't really talk about Ozempic because we shouldn't, because that's for diabetes on the NHS, and we don't try and use that brand. Wegovy's the same medication. So it's Mounjaro top of the list, Wegovy's second, Saxenda still there, but actually nobody really uses it, right? Why would you inject yourself every day and only get 5% weight loss when you can inject yourself once a week and get 20 to 25% weight loss?
Wow, that drastic.
That drastic, right? Yeah. I guess the other thing that sets Wegovy aside, though, is Wegovy, because it's been around for longer and semaglutide's been tested for longer, it has got the backing of the SELECT trial. So the SELECT trial was a trial that came out about last 18 months or so. And essentially, it showed that whether you have type 2 diabetes or not, if you are overweight or obese and you've had a previous MI, stroke, TIA, any form of cardiovascular thing, heart attack, stroke, mini stroke, whatever it might have been, if you are treated with Wegovy or semaglutide, you will reduce your risk of a further event, another heart attack, another stroke, possibly death, by 20%.
Wow.
Okay? So whilst it may not be the strongest at weight loss, the data suggests that it has this really great cardioprotective effect. And so if you've got someone who's already had something happen to them, like a heart attack or a stroke or a mini stroke, then I would probably choose Wegovy first over Mounjaro. But if you're younger and your main aim is, I need to lose weight, then Mounjaro is probably your go-to medication. The thing about Mounjaro and its cardiovascular outcome data is that the trial's ongoing. It'll hopefully be around in 2026, I think, is when it'll report. And when it comes out, then we'll know whether it does the same cardiovascular benefit that Wegovy does. But as of this time, the evidence base for cardiovascular benefit sits with Wegovy. So you have to tailor the treatment based on who you're looking after. So it's not as simple as saying you'll just use the strongest one. But then there's also the bit around people tolerating one or the other. So in my practice and in our weight loss clinic, we give people the option. So some people will start on one and say, actually, this isn't really working for me, and then change to the other one, or the vice versa. And actually, that is something that's really important. It's about making sure that patients get all the options, and then you guide them through those options and support them step by step. So there isn't a clear outright winner when it comes to these things.
It's really interesting because before, obviously speaking to you, looking into it, when I knew you were coming on, it was always kind of Ozempic, right? I was kind of just what's out there, but it seems like that's not really even considered now. I wouldn't even consider it now. I'm speaking to you, Wegovy and Mounjaro, right? But now you mentioned tolerance. What are some of the side effects of, if any, of these medications, and what are the things that people might get that makes them come off it? Yeah.
So in terms of side effects, right? So if you do things right and you're counseled well, you can avoid a lot of the side effects. But the side effects that we tend, if I was sitting with a patient, my usual kind of, pardon me.
Okay.
So if I was sitting with a patient, my usual kind of counseling session would go something like this. Look, this is how it's going to start. You're going to start on a low dose, and we're going to build up the dose gradually. The reason we start on a low dose is because we want you to have a peaceful journey without side effects so that you enjoy your weight loss journey. The commonest side effects that you can get are nausea. Okay, and the reason you get nausea is because one of the mechanisms, as I said before, is it slows the stomach emptying. So if you think about it, the moment you take the medication, your stomach slows down. If you eat the same amount of food that you would normally plate up for yourself, there isn't anywhere for that food to go. So you'll start to feel very uncomfortable, more nauseous, and you're potentially going to be sick. So what because the food's still stuck there, there's nowhere for it to go. So what I say to people is, in the first few days when you start the medication, what you've got to do for me is you've got to make a conscious effort to reduce the portion size. After about day 2 or 3, or sometimes even on day 1 for some people, the medication kicks in and they don't have to make the effort anymore. They just automatically eat half the portion size.
It just happened.
It just happens. And it's a very interesting sensation for a lot of people. They're like, whoa, how am I saying no to that? You know? And they often talk about the noise dying down in their head, the constant battle about what they're trying to say to themselves, to say, don't eat anymore, stop there.
Yeah.
That disappears for a lot of people.
Interesting.
So nausea is kind of the commonest thing, and I tell them to manage it that way. The other thing you find is in the first 2 to 3 days, some people get a bit of diarrhea. It's mild and it disappears. Some people can go the complete opposite and be constipated. And if they get constipated, we have to manage that. And the reason for constipation often is, it slows the gut down a little bit. But more than that, when you're on these things, you reduce your portion size so much that you don't actually get enough fiber going into you. So we often have to tell people, look, I need you to increase your fiber intake. And also the other thing you do is when you control your appetite so well, sometimes people's thirst also gets controlled. So we almost have to make people drink consciously 2 or 3 liters a day, because you need that fluid and you need enough fiber, enough volume of food in any form to be able to get your bowels to go regularly. So those are the commonest things that people feel. We also warn people about, abdominal pain from heartburn, gastritis, because, your stomach slows down, the acid sits around for longer. Occasionally people, if they eat a little bit too much carb, they get these eggy burps and stuff. But again, it's about saying go low carb, avoid gluten if you can when you're starting off. When you lose weight, the other thing you find is that effective weight loss results in gallstone formation. So we do warn people to look out for any sort of abdominal pain in the right upper area of the abdomen. And if they do get that, they need to just get checked out. There is a risk of pancreatitis, which is listed in the medical product characteristics. I have never really seen one. It tends to be because you get gallstones, and then the gallstones cause pancreatitis, right? And essentially, it's something we warn people about. They need to stop. They need to get checked out. But most people, if you counsel them right, will sail through the journey. And it's such a positive journey for them, because the weight loss and that control, that feeling of being able to say no, has been something that they've missed for so long that they are literally motivated to keep going. Sometimes, because it's what it is, you know. So side effects can be managed. They do happen, like with anything we give people. But it's about making sure that you look after them and you counsel them, because actually, once you get past it, the side effects tend to settle as you settle down on a higher, more stable dose.